Questions about that, John will be available, at the break and also at the end of the evening. Now, last announcement. I'm happy to tell you that after 3 years of saying it should happen, Will and I are finally at work with I think a good plan for promoting the Omega-C treatment for viral disease. That is the use of very large quantities of ascorbic acid, 50 gram, 100 gram quantities, administered by IV drip, very painlessly and comfortably. And as Tom Levy showed in his book, and when he spoke to us a couple of years ago, that there's lots of research which is ignored, showing that a variety of viral diseases can be cured using this treatment. And the interesting thing about it is that it's very dramatic, very quick. And I'll tell you just two quick stories. But before I tell you the stories, let me tell you what Will and I are doing. We're going to make a video documentary of people before, during, and after this treatment. Instead of presenting a lot of research which no one looks at or believes, we're going to just show the American public that this treatment works, and we have a plan for reaching the American public once we get these videos made. And that plan is in this proposal here, which is on the table. So I hope you pick it up, because we're going to be looking for you all to help us find patients, especially patients with shingles, which is a very dramatic disease, and you can actually see the symptoms regress in a single infusion over 2 or 3 hours. This is what we want to show in a video. When people see this happening, let me tell you the two stories. One is, I was talking to Dr. Tim Guilford about something else, and I mentioned that, I was sending a friend of mine who's an attorney, Stanford, MA in mathematics, over to see him because she had shingles. And by the way, 2 treatments, which is not enough, but 2 treatments and she was completely cured. Should have been 4. I don't know why she didn't get 4, but she got the first one, pretty much knocked it down, and then they upped the dose and did a second treatment, and that was the end of it. And we'll be interviewing her. But what we really want to do is get people on camera who are suffering and have their faces swollen and their eyes, swollen shut and their faces inflamed. We want to show that changing. This is why I know it can be done. I talked to Tim, and he said, I was treating a woman who, I can't remember what it was, maybe mercury toxicity, and she brought in her husband, who didn't believe any, thought that alternative doctors were kind of strange and he would never get there, but he was suffering, so he said, what the heck, what have I got to lose? He comes in, his face is inflamed, his eye is swollen shut. Tim sits him down, starts the drip. In 2 hours, his eye opened and the inflammation was about 80% regressed. And at the end of 5 treatments, he was cured. That was it. That's the first story. I don't have time to go into details, so let me run on to the second story without trying to get into the wrong kind of consciousness here again. The second story with Tom Levy. Tom has had experience with encephalitis, which is not a disease we're going to show in this video because it's so dangerous that we wouldn't have any access to people with that. But Tom has had patients with encephalitis that he's treated where he gave them an injection, intramuscular injection, and in about 30 minutes, the people came out of comas. The fellow came out of a coma. Now this is anecdotal stuff, but when we get it on video, and then we interview the people, interview the doctors who are supervising, then I think people are going to believe it, because seeing is believing. This is our plan, and how we're going to distribute it and use it is there for you to see. We have a plan that's going to work, but we need your help finding patients. So pick that up, see what diseases we're looking for. When you hear your friend has shingles, and you hear a guy who's 35 years old has the mumps, he's worried about his losing his fertility, let us know, and we'll line him up with one of the doctors, Tim or F.U. May and Jill Snyder, MD, out of Choice Healing, whatever, Bob Cathcart, and we're going to be, Bob's our main man in this video, and so we need your help, and we'll be talking about this from time to time. This is not a Smart Life Forum project. This is a project of Will and myself, but we're going to use our friends, use all of your connections, and we're looking for referrals. Okay, I'd like to take questions on that, but we got to move right on here. So I want to bring up Don to introduce our local celebrity, who's not just local, who's world famous. Don will explain.
Okay. Thank you, Phil. This evening, thank God, we have a national treasure in this room of wonderful, wonderful people. there's a lot of horsepower here. And while Dr. Bob Cathcart trained at Stanford, San Francisco Medical Center, and back to Stanford, and while he and I have devoted our lives to science, prayer, and goodness for human beings, we have people, Dr. Bob, in this room who have devoted their lives to fast women, slow horses, and demon rum. Now, some of these people are not worthy of being helped. As a last desperate effort, Bob, we would like to call you forward, but perhaps you can do something with them, because God only knows I've lectured to many of them. I am not getting through, so hopefully you can.
What are their initials?
Well, I started this work on vitamin C in 1969. I was an orthopedic surgeon. I was trained at Stanford, and I was in private practice at Mills Hospital in San Mateo. And I had frequent colds, and I went 2 months without a cold. It was very lucky. And I also had seasonal hay fever. And in early 1969, I heard that Linus Pauling was writing this book about vitamin C and the common cold, so I decided to try it, and as luck would have it, I got this powdered ascorbic acid that had a concentration of 4 grams per level teaspoon. I didn't know how much to take, and so I just took a teaspoon, which was 4 grams. I had no idea how much that was and how that was going to kill me, supposedly. So I took it, and within about 15 minutes, I hadn't expected this. I was trying to prevent the cold. But my hay fever went away and stayed away for about 4 hours, and then it started coming back, so I took another teaspoon and went away for another 4 hours, and so I took another one and another one, and so I'd taken about 16 grams in this one day, and I was free. So I decided to keep this. Well, I went for about 9 months before I caught, and I did catch a cold taking 16 grams a day. Now, I've had a lot of patients come in and tell me, since I read Linus Pauling's book in 1970 and started taking vitamin C, I've not had a cold since that time. Well, you can't prove that by me, but there was something really the matter with my immune system, and so I was getting colds all the time. So I went 9 months without a cold. So then I took the 4 grams of vitamin C, and I noticed after about a half an hour that the symptoms went away, but they came back in about a half an hour. So I took another dose and another dose and another dose, and by the end of the day, I'd taken about 60 grams, which ordinarily would have caused diarrhea. And I thought, hey, that's interesting. Well, the next day I was all well. So anyway, and I went back to the 16 grams a day. So I tried this out on patients, and I found that without exception, in people who have a 100% normal GI tract. Now, what I mean by that is no esophagitis, no gastritis, no duodeninitis, no ulcers, no nothing, no irritable bowel syndrome, or anything like that, that this person can usually take from 10 to 15 grams of ascorbic acid divided up into 4 to 6 doses per 24 hours before it produces diarrhea. Now, there are some people that even like 5 grams will cause diarrhea, and we'll get back to that. But the astonishing thing was, let's say this person would get diarrhea at 15 grams a day. With a mild cold, they could take 30 to 60 grams. Now, this just blew my mind. And with a bad cold, they could take 100 grams. With the flu, they could take 150 grams. And I realized the magnitude of this phenomena when this 23-year-old, 98-pound lady librarian came in with severe mononucleosis. She ate a pound of ascorbic acid in 2 days without so much as gas. Now, by the 3rd day, she was feeling almost well, and by a 4th or 5th day, she was all well. Now, this, as I emphasize, this is not something, in these people who can really take these doses that I'm talking about and really get the idea, this works in 100% of the people.
I don't think it's a matter of medicine. I think it's a matter of chemistry. I think that if you put in enough of these electrons from these doses of ascorbic acid, that it will neutralize the free radicals and take away the symptoms. Now, sometimes what happens, and this is a very interesting phenomenon, is sometimes people get what I call unsick. You see, what usually happens when people take massive doses of C, first of all, maintenance doses, is it depends upon a person's, I call, say, gremlins sometimes. You know, you could kiss the wrong person when you were 14 years old and get Epstein-Barr virus, and maybe not even get mononucleosis, but you're infected with this virus. Or you might have herpes 6 or cytomegalovirus, or there has to be at least a dozen or so other viruses that you could be carrying. You know, when I went to medical school, they taught us that on our brains and bones and liver and spleen and bloodstream we were sterile. Now we know that's not true. We all have these bugs inside of us, and it depends upon the number of bugs that you have that are producing a certain amount of free radicals. So that the number of free radicals that is being made in your body generally determines what your maintenance dose should be. And of course, with normal people, young people who are feeling pretty well, I don't think that they need to push it to bowel tolerance all the time. I think that when you reach what I call the age of wrinkles, you may slow down the aging process if you titrate pretty close to bowel tolerance. And now this will vary from time to time and day to day. I mean, you could be making this many free radicals one time during the day and this many free radicals another time during the day, and the amount of ascorbate that will cause diarrhea here is not enough for here. So if you have a pattern like this, you take it like this. If you have a pattern like this, you take it like this. Well, now how much is that? That's like, how do I know when you're hungry? I don't know. You know. The worse you feel, the more you take, the better you feel, the less you take. Now, I know because I'll get a little bit of congestion. And so I titrate to the point that this sort of a blah feeling in my head is gone all the time, you see. Okay, well, now, but then sometimes, and usually, if you're taking those doses and you feel a cold coming on or a flu coming on, you quickly up the dose, and you may start taking, 2 or 3, 4 or 5 grams every 15 minutes to every hour. I mean, until you begin to start getting diarrhea, and about 9/10 of the time, the cold will just go away within a few hours. But sometimes you'll get the cold anyway, and then you get what I call unsick. Now, what this means is that you'll feel the symptoms in a sense. You know that you're sick, but all the soreness, the coughing, the sneezing, and all that is suppressed by this. And this is the darndest thing, because you can turn the cold off. In other words, if you get unsick, say maybe you've been unsick for 2 days, and you stop the vitamin C, you're going to get sick right away, you see. And so you keep this up until you get well. Now, the interesting thing about this, I hope there are no enemies of vitamin C here, because I don't like to tell people this, but you can stay unsick a couple of days longer than you would have been uncomplicated sick. Now, what I mean by that is that if a cold maybe routinely lasts for 7 days, where I got all this experience was I had to leave San Mateo where I was doing orthopedic surgery. It's a long story, but I went up to Incline Village where for the first few years I was the only doctor in town, and if you came to see me, you had to take vitamin C or go over Mount Rose into Reno, which was difficult in the wintertime, or go into Truckee, which in my opinion was a fate worse than death. And that was another snow pass to go over with. So that by the time an internist came about 3 years later, half the town thought I was crazy and the other half thought I could walk on water, and that was okay. So we were taking more vitamin C per capita than any place in the world. Now this was between 1970 and 1980 that I was in Incline Village, and that's where I got all this vast experience with treating of these infectious diseases. I cannot remember having anybody with acute infectious disease. Now, mostly colds and flus, but we got mononucleosis and gonorrhea and hepatitis A, B, and they called it non-A, non-C, and non-B in those days, and syphilis and all these things, pelvic inflammatory disease and so forth. And I didn't hospitalize a single patient during that entire time. And we must have had 4 or 5 epidemics of flu during that period of time, and we just pushed the vitamin C. The other thing about 1972, I got onto a no sugar kick, and I've never regretted that. Is if you come see me, you're going to get a lecture about sugar. and you've got to stay off sugar. I think that sugar is a big killer of our time, and it's responsible for a lot of the degenerative diseases that we have. Also, sugar competes with vitamin C getting into cells, and the more sugar you eat, the less vitamin C you get into your cells, you see. And so it helps to augment the effect of vitamin C to get into the cell. But anyway, this unsick thing is that it can last a couple of days longer than uncomplicated sick. Now, what I mean by that is that if you have a particular epidemic that maybe lasts for 5 days, then a few, maybe 10%, will go on and get a bronchitis or you know, sinusitis or something or other like that, and they stay sick for a couple of weeks or a month or so and so forth, and maybe 1 or 2% wind up in the hospital with something, with a pneumonia or something like this. In my experience, this never happens in people who are good at taking vitamin C. Now, the thing about it is, though, you see, the other thing, remember I said that my hay fever went away with these massive doses of ascorbate. Somehow, I think ascorbic acid in large doses augments cellular immunity and suppresses humoral immunity. Now, I think that humoral immunity is turned on by free radicals, and that by neutralizing the free radicals, you're not as sick, and so you don't build up antibodies as fast. So sometimes that's why you stay unsick longer than you would have stayed sick, uncomplicated sick, you see. But you never develop complications, and you're not coughing and sneezing and spreading it around a lot. So I tell you, even people who experience this unsickness would never trade it for being sick. And so anyway, now the intravenous vitamin C. I am a big pusher of oral ascorbic acid. By the way, when I'm talking, I'm always talking about ascorbic acid orally. Now, actually, that's one of the arguments I had with Tom Levy. He thinks he gets what I call the ascorbate effect, is this sudden suppression of the symptoms. And what I mean by that is that, let's say if you're this sick with what I call a 100-gram cold. Now, remember when I said with a bad cold, you can take 100 grams sometimes without it producing diarrhea. I call that a 100-gram cold. If you have a little cold and it causes diarrhea, 30 to 50 grams, I call that a 30 or 50-gram cold, you see. And so if you have a 100-gram cold and you're this sick, and you start taking 10, 20, 30, 40, 50, 60, 70, 80, suddenly the symptoms begin to drop off. This is a threshold effect. And I think this is what you would anticipate. You know, redox potential is determined by something like the concentration of the oxidizing substance times K1 divided by the concentration of the logarithm of the concentration of the reducing substance times the logarithm of K2. Well, anyway, what the emphasis is of the logarithm. You know how logarithms go like this, or actually go like this. Well, the clinical effect of these massive doses of ascorbate is like this. And what I think you're doing is driving a reducing redox potential into the affected organs by the disease. So you're driving a reducing redox potential into the nose and throat, and that eliminates the symptoms. And it may or may not get rid of the virus. I think that if it augments the cellular immunity enough so that the cells are able to eat up the virus, then you're well in a day, you see. But if it doesn't manage to do that, if somehow or another the virus can escape that, then they have to wait until the immune system takes over. Now, we have found that these massive doses of ascorbate are extremely helpful in hay fever and asthma. I mean, I have all sorts of patients who come in that are on prednisone and all sorts of other diseases, inhalers and so forth, for asthma, and we're able to get most of them off about 90% of these drugs, sometimes 100%, by giving them massive doses of ascorbic acid. Now, one of the things, there's this book by Alan B. Clemenson, that MD, and he's a professor at Tulane, who wrote a book that was published in the CRC Press in 1989, which was just on low doses of vitamin C. In 1989, he wrote this beautiful book, essentially about scurvy and all of the different diseases or the conditions that would cause what he called hypovitaminosis C. And I sort of like that term better than I do Irwin Stone. Oh, bless Irwin Stone. He called it subclinical scurvy, chronic subclinical scurvy. But anyway, this hypovitaminosis C, I think, has less of a stigma about it. And I have a whole list of the things that he says that causes hypovitaminosis C. And he emphasizes he's not talking about a lack of vitamin C in the average American diet. He's talking about that these things cut down the vitamin C in your body. Aging, smoking, infection, trauma, surgery, hormone administration, heavy metals, pregnancy, hemolysis, ionizing radiation, aspirin, alcohol, and other drugs. All these cause an increased destruction of ascorbic acid. And so all of these conditions, and there are even more, anytime your body is stressed, you know, the adrenal glands have about the highest concentration of ascorbate in all the organs of the body. And when you're under stress, the vitamin C is burned up in your body, and this causes this hypovitaminosis C, which then doesn't necessarily cause the classic symptoms of scurvy, but may cause little individual symptoms, like, for instance, the immune system being suppressed, or like easy bruising, or lack of memory, you know, spiders and more wrinkles and aging more rapidly and things like that. So, and degenerative disc disease. Remember, vitamin C is extremely important as far as the buildup of collagen fibers and dentine. Well, if your collagen fibers start breaking down, then you're going to start herniating discs, and you're going to have you know, torn tendons, like people will rupture their Achilles tendons, or get bursitis of the shoulder where they've ripped a rotator cuff and things like that. And it turns out, actually, there's some of the football teams that their trainers secretly use vitamin C as a secret weapon. They find that the football players get less injuries and less soreness of the muscles and so forth, and when they take large doses of vitamin C. And we found that after surgery, if you give huge doses of vitamin C, that the pain medication and so forth is reduced tremendously, and you heal more rapidly. And one of the people that I've heard rumors that, okay, that increases the scarring, but it really doesn't. What happens is the tissues just come together and they heal. In fact, one of the symptoms of real scurvy is the dehiscence of wounds. And I mean, even some wounds that have been healed for years will dehist with frank scurvy. And one of the other symptoms of scurvy, which is not very well known, is osteoporosis. And remember that osteoporosis involves lack of bone matrix. Calcium, well, you know, but bone matrix, if it's there, it calcifies. And so we think that osteoporosis is primarily a bone matrix deficiency, and that's why things like vitamin C and zinc, manganese, chromium, selenium, boron, and exercise and estrogen and all these things help more to build up the bone matrix. And so I don't push calcium, but that's another long story. So anyway, this thing that I'm talking about, this sudden drop of a symptom, I call the ascorbate effect. Now, I wanted to give this talk because of the possibility of a bad flu. Now, people have talked about that there's a cytokine cascade which occurs with this bird flu that's extremely fatal. So all I got to say is that if this bird flu hits, you better have the vitamin C on hand, and you better take it fast and hard. And because what I mean, if it gets out of control and you get into respiratory difficulty and you go into a hospital, they're not going to let you take vitamin C. And so the thing is that you got to hit it hard, and that may mean that you got to take 100 to 2. It may be a 200-gram disease. It may be a 300-gram disease. I don't know, because I've heard rumors that there's some hemorrhage. It may be a hemorrhagic fever to an extent, and you take hemorrhagic fevers like Ebola virus, and anyway, they may be 300 to 500-gram diseases, and in those cases, only intravenous C is going to provide it fast enough. An interesting thing. Now, you might say, well, you know, this is crazy. How come that this is so important? Well, all other animals, except for man monkey, the guinea pig, and the African fruit-eating bat, make ascorbate. This is why our dog can eat terrible things off the ground, why it can bury a bone and let it rot for a few days and dig it up and eat it. They make ascorbate in their liver like we make saliva. There's this one liver enzyme called L-glutathione oxidase that we lack genetically. This happened about 65 million years ago up in the trees, the higher primates, where they were living in sparse population and dirty things were falling to the ground, and it developed these arms and hands. and they were picking up clean things, and one of our distant cousins was born that survived, that didn't produce ascorbate, and had this interesting advantage. You might say, well, if this is so important, how come we would have lost it? Well, the thing is that these other animals don't get ascorbate for free. They make it from glucose. So maybe 20% of what your other animals eat goes into making ascorbate. That means that we are better at starvation than other animals. You know, humans really are good at starvation. We don't like it, but you look at the pictures of people in Dachau, and it is truly amazing how long people can go without food. Well, a wild animal will probably burn itself up making ascorbate faster than humans. So I think that was the advantage. Now, when the monkeys came out of the trees and started hurting large civilization, then diseases like cholera and plague and smallpox would wipe out small percentages of the world population until we got modern sanitation. And I think immunizations helped a little bit, which, by the way, the question about immunizations, I say whether you should be immunized or not depends upon your skill at taking vitamin C. If you get to be skilled at taking vitamin C, don't take the immunizations. But anyway, that's just my opinion. So anyway, but the vitamin C is extremely effective in the treating of various different allergies. It increases healing, and I think it prevents osteoporosis. Now, I think that osteoporosis is also caused by endogenously produced cortisone. This is one of the things that the doctors don't talk about. But when you go to have an allergic reaction, or when you're under a stress, or when you have a chronic infection, your body makes adrenaline and/or cortisone to try and block the inflammation caused by these situations. Now, the adrenaline type person is the type A personality who's very volatile, and the type B personality is more heavy set, collects fluid. Most people are crosses in between. But remember, cortisone causes osteoporosis. And so I think this is one of the causes of osteoporosis, are these hidden infections. So that when we see elderly ladies that come in that have these tests in their bones say that they've got early osteoporosis, we take them off all sugars. I mean, you know, if you're made of sucrose and you start falling apart in your old age, big deal. What else is new? Come on. And so we get you off sugars. We put you on an anti-yeast program, because we find out when people are elderly, they almost always, well, if you get any immune suppression of any sort, this yeast they call Candida, the doctors and the mycologists call it Candida, but the public is calling it Candida. This is very controversial, but whatever, it's not an infection. It's not like vaginal Candida infections. It's like everybody has X amount of this yeast in them as a result of having 10X. You get so sensitive to it you can't stand 100th X. That's why you've got to be so fanatical about the sugar. These people, I have patients with chronic candidiasis, and I see a tremendous number of them because none of the other doctors in town, well, I apologize, maybe some of the other doctors in here treat Candida, but they're the only ones in the area that do. And so these patients learn that I treat chronic candidiasis, and so I see all sorts of ladies that got chronic candidiasis. I don't mean to pick on the ladies, but they have 4 or 5 to 1 to the men as far as chronic candidiasis is concerned. So we give them the anti-yeast program, high doses of vitamin C, zinc, manganese, chromium, selenium, and vitamin E, and high doses of the B vitamins. And actually with osteoporosis, I give them boron and strontium, and we just don't have trouble with osteoporosis. And that just seems to be what it is. And so anyway, right now I'm sort of interested in autoimmune diseases. I think that autoimmune diseases first of all, B cells make antibodies. And when a B cell is born in the body, it takes on a random combination of the type of antibodies it makes. It goes around and tries to match the chemicals on the surfaces of cells. And when an immature B cell matches something, it dies. A mature B cell matches something, it multiplies and produces antibodies of that shape. Well, so what happens, we're born with millions of different B cells making millions of different antibodies, except for the ones that exactly fit the chemicals on the surfaces of our cells. Now, what happens when we get an infection, like a cold? Our immune system is upregulated for a few days, and that's okay. But if we get chronic candidiasis or Epstein-Barr, herpes 6, or we have chronic allergies or something like that is happening all the time that produce free radicals, this chronically upregulates the immune system, and we start coding in sensitivity reactions either to the bug itself or to foods and chemicals that we're exposed to. Now, Like, for instance, if every time you have a cold, you stay home and eat peanut butter and jelly sandwiches and a glass of milk when you're a kid, you're likely to be allergic to those things. If I see an Oriental, I'm more suspicious of rice, for instance. There are exceptions to all this, but anyway, we find that sometimes then the antibodies to either the bug or the food or the chemical cross-reacts with different organs of the body, and like if it cross-reacts with thyroid, you get a thyroiditis, or the skin, you get a skin rash, or to your blood vessels, you get lupus, or your joints, you get rheumatoid arthritis. And so I treat all these things the same thing, and it is surprising how many people we go into remission. I have particularly good results with lupus patients right now. Now, I wanted to say something about a lot of you people here. Now, I've been see, if I got all this experience up in Incline Village, Nevada, where we have young, healthy, athletic people and children who take vitamin C like it's going out of style. When I came down and gave this talk to the Orthomolecular Medical Society about 1975, there were more people in that room who couldn't take vitamin C than in the entire town of Incline Village. I'd never seen anybody have trouble. Now, I'm sure that a lot of you people out here can't take vitamin C. And I got to tell you that if you take ascorbic acid and it burns your stomach or esophagus or gut, something's the matter. You've got Helicobacter or Candida or something rather. It needs to be cured, because a normal stomach just doesn't have trouble with ascorbic acid. Ascorbic acid has a pH of 3.5. Hydrochloric acid has a pH of 1. And that means, and the low number is more acid, it's thousands of times more acid than ascorbic acid. So if ascorbic acid burns your GI tract, you got a problem, and you ought to take care of it. Because, so anyway, we have to work with these people who have these difficulties with their GI tract. And I put them all on the anti-Candida program. For some reason, I think even viruses and bacteria, I know Helicobacter doesn't seem to like the anti-yeast program. I got very excited back when I first heard about Helicobacter. There was a triple therapy, which was ampicillin, Flagyl, and Pepto-Bismol. And I found that some of my chemically sensitive people didn't do very well on Flagyl. And then after I did about a half a dozen people checking their blood and all that, after about 6 months, what happened was that we found that they got well just as fast as the people in the anti-yeast program. I think they're signaling me to stop. So anyway, what do you...
Very much, Bob.
Yeah.